Thank you all for joining us on a Friday night to learn about kittens. I appreciate you being here. There's a lot of information to go over tonight, so we're gonna really speed through this webinar. But just in case you missed some stuff, I just wanna remind everybody that this will be recorded. So you're gonna get a recording of this. So if you miss something, if I go too fast, it's okay. You'll be able to go back and listen again. My name is Andy, and I founded Esther Neonatal Kitten Alliance in 2019. I've worked with kittens now for about 13 years, and I have a special affinity for the most vulnerable cases. So I really like the youngest, sickest, most injured kittens, and that is what my organization is based around. This kitten here is my cat, Toby. We took him in about 4 days old. He had an umbilical strangulation in one of his back legs. And he was very close to having a fatal sepsis infection. He required a lot of work, but now he's a happy tripod. At the Kitten Alliance, our mission is to provide care and rescue to newborn and medically challenged kittens. And since 2019, we've cared for thousands of kittens on our own. We partner with hundreds of rescues and shelters throughout our region. We're in Asheville, North Carolina. And we've taught thousands of people how to care for kittens of all ages, but particularly bottle babies through in-person classes, training programs, and online webinars like this. You are going to hear me use the word neonate today, so I just want to make sure we're all on the same page about what that means. So a neonate is essentially, when we're talking about kittens, it's going to be a kitten who's under about 4 or 5 weeks old. Once they hit that 4 or 5 week old mark, they're going to start being a little bit more independent. So we're talking about the really, really young ones today. In order to know what kind of care a kitten needs, we need to understand how old they are. So of course, a 1 week old kitten, the kind of care they need is a lot different than the kind of care a 6 week old kitten needs. So this slide and the next one will kind of walk you through how to age a kitten. So generally a kitten loses their umbilical cord when they're about 5 days old. And kittens start to open their eyes usually somewhere between 7 and 10 days old. Around 2 to 3 weeks old, their eyes will be fully opened, but they won't really be focused. So they're going to be little googly-eyed aliens for about a week. And they're going to start moving around a lot more, getting a lot more active, but they're going to still be pretty uncoordinated while they explore. Around 3 to 4 weeks old is when they're going to start getting their teeth in. So the first ones they're going to get in are their incisors. Those are those little tiny ones right at the front of their mouth, right below their nose. Between 4 and 5 weeks old, they're going to get their canines, which are the really sharp ones on the sides. And then between 5 and 6 weeks old, they're going to get their premolar teeth. And those are the ones all the way in the back of their mouth. And once they get those teeth, that's how you know they're ready to start weaning. So before we get into the kind of care they need, I just want to always take a moment to talk about where these kittens come from. So most kittens who end up at shelters are born to outdoor community cats. And if you don't know what a community cat is, those are those outdoor cats that you might see around where you live, work, or shop. Community cats can be friendly, but they're often fairly under-socialized. They might not be cats that are going to allow you to touch them. But these cats, if they're not spayed and neutered, they can get pregnant as young as 4 months old, and the gestation period for a cat is only about 2 months. So a 6-month-old kitten can give birth to her own litter of kittens, and because of the 4-month mark and the 2-month gestation, what that means is a kitten born in the spring can have her own litter of kittens by the end of that year. And I will tell you, after doing this work for a very long time, that there is almost no pathway to a 6-month-old kitten having a healthy pregnancy and birth. So it's really important to cut this off. And just, if you can think about how, a cat can have several litters of kittens per year, each litter of kittens is on average, probably 4 or 5 kittens in a litter. That, of course, means that the population of outdoor kittens grows so much. So with community cats, a lot of communities have trap, neuter, return programs, and that is when people go out and humanely trap these cats, get them spayed and neutered, get them vaccinated for rabies, and then return them to their outdoor homes, where usually if a colony of cats is congregating somewhere, it's because they have a food and water source. So somebody there is likely looking out for them. But while they're under anesthesia, the tip of their ear is cut off. It happens while they're under anesthesia, they don't feel it. But this tip is a really good indicator, because even if it's a feral or semi-social cat who won't really let you handle them, it's really easy to see from a distance whether this animal's already been spayed or neutered. And especially it's helpful for the people who are doing that trapping. So if they trap one of these cats, they can very clearly see that this cat's already been altered, and they can just let that cat go. They don't have to bring it to the spay neuter clinic, put it under anesthesia, shave the belly, and then, have somebody at the clinic find out that that cat's already been altered. And then, they have to wake up from anesthesia, maybe spend the night somewhere and then go back the next day. It really helps not stress out the cats, not use up unnecessary resources. So, of course, not all of the cats who are being brought to shelters are truly orphaned. So let's talk for a minute about how you can tell the difference. If you were to come across a kitten outside, what signs you might see to let you know whether or not there's a mom around. Because, of course, moms do have to leave their kittens several times a day. They'll leave to go get food, water, do other cat things. And they, of course, can't bring a litter of kittens with them to do that. So moms several times a day will leave their kittens in a place they've deemed to be safe. And usually within a couple hours, they will go back to their kittens. So if you were to come across kittens, some things you might see that could indicate that these kittens actually truly need help are they might be wet or cold to the touch, they might be limp or lethargic, have some sort of visible injury, like this first kitten has that eye injury, or they might be ill, like this third kitten, or really any of those other kittens, who, missing a lot of hair, really bad eye infection, stuff like that. They may have visible parasites like maggots, fly strike, or a botfly, like the orange one all the way on the end. She had a botfly in her neck. They may be very dirty or greasy if a mom's not consistently grooming them. They may be crying for food, and the cry that they make when they're very hungry versus just the general meow a kitten might make is it's going to be a more desperate cry. They may be very skinny, although in kittens who are starving, we often see that their bodies are very skinny, but they have big bloated bellies. Or they might look healthy, but they might be in an imminently dangerous location. So think, kittens right on the side of a really busy highway or in an active construction zone, someplace where if they're left, then they're in really imminent danger of being hurt or killed. If you find kittens and they look very healthy, those are kittens who do have a mom taking care of them. So these are kittens who are going to be warm, nice and bright and active, no visible injuries or illnesses, no visible parasites, except for maybe a few fleas, which are common in pretty much any animal who lives outdoors. They'll be clean and well groomed, nice and quiet. They'll be nice and plump. Their bellies, instead of being hard, they'll be nice and squishy. And they'll be in a reasonably safe location. And we do know that it's hard. We understand that it's hard to leave kittens behind when you find them, but it's really important for a few reasons. One is that no matter how good of a foster they have, the mom cat always does a better job. And kittens have a much higher chance of survival when they stay with their mom. Next is that there are a finite number of fosters for cats and kittens, especially when it comes to kittens who need to be bottle fed. Most shelters only have one or two. So it's really important that if there is a mom who is able and willing to be caring for these kittens, that they stay with her at least through the time that they're weaning. And then third is that basically all shelters all over the country, and particularly here in the South where we're located, shelters are packed full, far beyond capacity. And a lot of shelters are having to make really hard choices to euthanize animals to make room for new ones. And these newborn kittens are some of the most likely animals to be euthanized at these shelters, especially when it comes towards the end of the day and these kittens don't have a foster home to go to, because the kittens that we're talking about can't stay overnight without somebody taking care of them. So this is just a quick chart to kind of guide you through what to do if you know that mom is there, what to do if mom isn't there, and if you're not sure. So of course, if mom is there, we don't want to kidnap these kittens. We want to leave them with her unless you're able to take mom too. If mom isn't there, then that is where you're gonna take them. You're gonna learn in this course how to give them basic care. And then at the end of this, we're gonna talk about one of our programs called Kittenology that'll teach you a little bit more about their care. And if you're not sure, we always recommend watching for a few hours to see if she comes back. You know, normally within 2 or 3 hours, mom will come back. And if you can't wait around, but you can check in a little while, you can sprinkle some flour around the nest and then go back later and check and see if there's paw prints. So neonates need foster homes, and there's a few reasons for that. Without foster homes, these tiny kittens really don't stand a chance at all. So the first thing is in shelters, most shelters don't have overnight staff. Their staff gets there in the morning, they feed and take care of everybody all day, and then their staff goes home at night. In shelters, oftentimes the staff are overworked and there's not enough of them. So these are people who are often wearing many hats, and it's really hard for them to drop everything they're doing to attend to kittens who need to be bottle fed. Many staff members at shelters are not trained to bottle feed, so you're potentially putting that on somebody who doesn't fully know what they're doing and may actually not do it correctly and cause a kitten to aspirate or, you know, some other danger. And then in shelters, there's just a lot of exposure to a lot of different things. So you're talking about an environment where there's a lot of animals moving in and out from, you know, a lot of places that we don't necessarily know what they've been exposed to. So if you're talking about an older kitten or an adult cat being in a shelter, it's a lot different because those cats are going to have stronger immune systems. They're often going to have at least 1 or 2 vaccines under their belt, and they're generally going to have an easier time shrugging off some of these things they might be exposed to. But with kittens, it can be really dangerous because their immune systems are so delicate. So in foster homes, these kittens are going to get 24/7 care by somebody who is dedicated to just caring for them. Their attention is not divided. Hopefully it'll be a foster who's trained and giving the supplies they need to provide the best care, and they're a lot less likely to be exposed to different things. So when it comes to newborn kittens and human babies actually have a lot in common. So as far as the things that they need, it's actually very similar. So we're going to talk about what baby kittens need that human babies also need. So the first thing is some sort of external warmth. Kittens can't actually regulate their own body temperatures until they're about 4 weeks old. And getting too cold can cause them to crash or fade, and that can be fatal. So it's really important that these kittens have some sort of external heat source. So when they're with their mom, she cuddles them all the time, she keeps them nice and warm. But if a kitten's too cold for too long, their organs actually start shutting down. So we really need to avoid that. Some of the tools you can use, the top 2 are incubators, which you may not have access to. The bottom 2 are easier to find. So this pink disc, it's called a Snuggle Safe disc. You can buy that on Amazon or a few other places online. And it's just a disc that you microwave for a few minutes and it stays warm for a few hours. Those are especially really good for traveling. The other one is an electric heating pad. And if you go the heating pad route, just make sure that you know that these days a lot of heating pads are made with a safety feature that has an automatic shut off after a certain period of time. So Sunbeam brand is one that makes one without an auto shut off, but you just have to, they make both kinds. So you just have to be sure what you're getting. And if you get one that does have an auto shut off, just be aware that every time you feed that kitten, you should be checking to make sure that the heat is still on. It can get really dangerous if you think the kitten is being kept warm and then you know, the heating pad has shut off and you haven't realized it and the kitten actually gets cold. Some safety measures are you never want to feed a kitten who's cold to the touch. Kittens who are cold can't properly digest food and formula. So you want to, the first thing you want to do is get them nice and warm. If people find kittens, it can feel kind of instinctual. If a kitten seems hungry, like they're crying a lot, you don't know when they maybe ate last. It can feel instinctual for the first thing you do to feed them. But in reality, the first thing you want to do is get them nice and warm first. So with a kitten who's under 4 weeks old, you're always going to have some sort of heat source with them. And you want to put a layer of blankets in between the kitten and the heat source so they're not laying directly on top of it. You don't want them, they have very delicate skin, so you want to be careful not to overheat them. And you want to position the heat source to be such where the kitten can move off of it if they get too hot. So even if a kitten is newly born, if they're just a day or two old, as long as they are active and alert, they're going to move on and off that heat source as needed. So being too cold and being too hot, both of them are dangerous for a kitten. Being too cold is the one that we see most often though. Maybe a few times a year we'll get in kittens who are overheated, you know, maybe they were found on the asphalt in a parking lot in direct sunlight, something like that. But by and large, getting too cold is the more common one. So a kitten who is too cold and hypothermic is going to feel cold to the touch. Their paws, their nose, their ears are going to start feeling cold. They may be lethargic because being cold is going to slow down the blood flow. And they may have pale gums. A kitten that's too hot may be panting. Their gums are going to be bright, really bright pink or even red looking, and they'll be warm to the touch. When it comes to housing, fostering kittens is actually one of the easy things about it is they don't take up a whole lot of space. So until kittens are about 3 weeks old, they can actually just stay in a carrier. They can stay in a carrier, on a shelf, on a table, you know, whatever. They take up very little room. And that's because until they're about 3 weeks old, basically all they do is eat, sleep, and poop. So they're very easy. They're hard because they take a lot of work, but they're easy because they don't take up a lot of space. Once they turn about 3 weeks old, you'll want to move them into a bigger space. They're going to start being a lot more active. And at that point, you can introduce a litter box, at least for them to kind of walk through and try to get familiar with. They're likely not going to start using it at that point, but you can give them access to stuff like that. But you can use a pop-up playpen like is pictured here. You can use a bathroom, you can use a laundry room, spare bedroom. Just make sure that wherever they go, they do have access to that heat source still until they're about 4 weeks old. Once they're nice and warm, you're gonna start being able to think about feeding them. So kittens have really delicate bellies, and cow's milk is not going to be good for them. So you want to avoid cow's milk. It can cause diarrhea, dehydration, malnutrition, all sorts of really bad things. So the first two things here are kitten-specific formula. The middle one, KMR with the blue on it, that's the one that you're going to be able to find in most stores. You'll be able to find that usually in PetSmart, Petco, Walmart, I think should have it, possibly even Target. That is a perfectly fine brand to use. The first one with the yellow is called Breeder's Edge. That's the one that we personally prefer. We have found that that is a little bit less likely to cause digestive issues. But the challenge is that you have to buy that one online. There's no stores that sell it. So that you can buy off Amazon. We tend to get ours from Revival Animal Health, but you'll buy that online. And then if you're in a pinch, if you have some kittens, you don't have any formula on hand, goat's milk is okay to use. And you can find that in most grocery stores. It'll either be fresh goat's milk in the refrigerated section near the cow's milk, or you can find a powdered or evaporated version, usually in the baking aisle. For feeding supplies, you're gonna need the formula, a bottle, nipples, syringes, a blender bottle, and hot water. These are the general supplies that all of our fosters keep on hand. So we just talked about the formula. With the bottles, we like these, the Pet Nurser brand. And for nipples, we really suggest investing in some Miracle nipples. You have to buy them online, but kittens tend to latch a lot easier to those rather than the nipples that come in the kits, which are the nipples that you see in the picture with the bottle. If though you don't have access to Miracle nipples and you are using the nipples that came in the kit, just know that those nipples are not pre-cut. You do have to cut the holes in them. And the size you want to cut those is basically you want to be able to tip the bottle over, and without squeezing the bottle, you want that milk just to go drip, drip, drip slowly out of that nipple. If you turn it over and you have to really squeeze the bottle in order to get the milk out, that means the kitten's going to have to work really hard to get the milk out. And we don't want to create a situation where a kitten is burning more calories trying to eat than they're actually intaking when they're eating. On the other hand, if you cut the hole too big and you turn it over and the milk is just pouring out, that makes it really likely for the milk to just to flood the kitten's mouth and to accidentally go into the kitten's lungs instead of their stomach, and that can be really dangerous too. So make sure that hole is just the right size. Go really slow when you're doing it. We always like to keep syringes on hand, just because if a kitten is not latching really good, you can actually put the Miracle nipples right on the end of these syringes, and just the suction power of the syringe can sometimes help a kitten get a stronger latch and make it easier for them to eat the formula. The blender bottle is what we use to mix up the formula. That's just a bottle that you would use to mix up like a protein shake. Has a little whisking ball in it. And what you'll notice with the nipples is that because the hole is really small, it's so small that if there's the smallest clump in the formula, the clump is going to clog the nipple and not allow formula to go through. And it can appear that the kitten is eating when actually they're not able to get anything because there's a clog in it. So you want to be really careful about that. And then hot water is what you can use to warm up the bottle. So make a cup of water like you would if you're making tea, and you can just sit the bottle in it for, usually to warm up bottle, it's really just it happens pretty quickly, maybe 10 or 15 seconds. And you'll just keep taking the bottle out and dripping a couple drops onto your wrist. And it's the right temperature when you can kind of just barely feel it on your wrist. You want it just to be a couple of degrees warmer than your skin. When it comes to preparing the formula, most of the kitten specific formulas are mixed one part powder to 2 parts water. But always make sure you're reading the packaging to make sure that you're mixing in the correct way, so that the kittens are getting maximum nutrition. The blender bottle gets the clumps out. You can make enough formula to last you 24 hours. You don't have to make formula fresh every single time you go to feed a kitten. And just make sure that once formula is mixed into powder, or once it's mixed from the powder into a liquid, that's going to be refrigerated. Any powder that's not mixed doesn't have to be refrigerated generally, and you can just keep that in a cool, dry place. But whatever you premix if you're making enough for 24 hours. After that 24 hours, anything that's left should be dumped and make a new batch fresh. And that's because after 24 hours, it can start to breed bacteria. And of course, we don't want to introduce bacteria into the kitten's belly. This is a picture of my little friend Cinnamon eating some lunch. And this video shows the correct position to feed a kitten in. So you'll see that he is belly down. He's eating essentially in the same position he would eat from his mom. When you're holding the bottle, you want to angle it to let gravity do its job. So you're just going to angle it enough so that the milk fills the top part of the bottle. So this part of the bottle where the cap is, you want the milk to be filling that area so that air is not getting through that nipple. So always feed the kitten belly down. You never want to feed a kitten on their back. That can make it so the milk goes into the lungs instead of the belly. And it's okay if the kitten's flailing a little bit, they're having a hard time getting a latch. If you take your fingers and just kind of brace the kitten's head, it's okay to manhandle them a little bit. They're not quite as fragile as they seem like they are, but it's okay to brace their head to keep them nice and steady so they're not doing that kind of head flailing thing that sometimes kittens like to do when you're trying to feed them. And if a kitten is refusing to latch, again, sometimes just switching to a syringe can help prevent aspiration because you have a bit more control of how much formula is going into that kitten's mouth, and you have a little bit more control over just kind of the whole process. As far as how often to feed the kitten and how much they should be eating, this is just a really rough idea. It's going to vary a little bit depending, kitten to kitten. But in general, if you're talking about a kitten who's under a week old, they're going to be eating somewhere around 2 to 6 mLs per meal, and they're going to be eating about every 2 hours. Every week that they grow, you gain an hour of sleep because what we're talking about is kittens who need to be fed around the clock. Sometimes you have kittens who want to eat outside of these times, like you might have a kitten who's a week and a half old, and according to this chart, they should be eating every 3 hours, but when you're going to feed them, they're not hungry, but you're finding that if you wait 3.5, 4 hours, then they're hungrier and they'll eat a full meal. That is okay for a kitten who is nice and active and consistently gaining weight. We're going to talk about weighing kittens in a minute. I wouldn't go much more than an hour off of this chart, and that is just because kittens, you want to keep their blood sugar nice and healthy, and if their blood sugar drops, that can cause them to crash and fade as well, so you want to avoid that. And as far as the amount they eat, generally, as long as a kitten is latching and eagerly eating, you can allow them to eat as much as they want, even if it's, some kittens who are 5 days old eat 10 or 12 mLs for a meal. That's okay as long as they are latching and doing that on their own. Overfeeding really only becomes dangerous if you are forcing food into a kitten. So if you are using a syringe to kind of force feed them, if you're tube feeding, something like that. But as long as the kitten's eagerly eating, you can allow them to eat however much they want. These are the charts that my team uses to track the health and weight of a kitten. So with this kitten, what we tend to do is for the first few days, until we can see that a kitten is consistently gaining, we weigh them several times a day. And then once they have gained a significant amount of weight, then we can go down to weighing them once a day as long as they're healthy and bright and active. So this kitten came to us at 11 a.m., weighed 154 grams. The kitten had a leg injury. We started, Clavamox is a brand of antibiotic, so we started him on that because he had a bit of an infection. At 6 p.m., he had gained 7 grams, which is what you'll see in that fourth column there with a plus minus sign. But he had some poop that was kind of loose. The next day, he continued to gain weight, but his poop got solid. The day after that, though, his latch became pretty weak, and you see that he had lost a little bit of weight. We tube fed him for a few meals, and then he got stronger. The next day, he was back to bottle feeding and had gained a pretty significant amount. It is really important to weigh kittens every day, and that's because we're talking about kittens that are so tiny that, you know, just a few grams of weight change is pretty significant for a kitten who might only weigh 200 grams to begin with. You know, that could be like you losing 50 pounds in a day. And if you lost 50 pounds in one day, there's probably something really wrong that you want to get ahead of. So we definitely suggest for the first week that you have a kitten until you're really familiar with them, that you weigh them several times a day. We suggest using a kitchen scale that can be weighed in grams. It's the smallest measurement of weight, so you can see really minute changes. And then once kittens are more stable and you're more familiar with them, you can go down to weighing them once a day as long as you're seeing that consistent gain. Now, you'll see from the chart that the times that we're weighing them are not exact, but they're kind of in the same range. So in the mornings, we're weighing them at, 10 a.m., 11 a.m. And then in the evenings, it's 6 a.m., 6 p.m., 7 p.m., something like that. It doesn't really matter what time of day you're weighing the kittens, but I would say try to stick to just pick a time that is generally working for you and kind of stick to it within an hour or so, and choose whether or not you prefer to weigh kittens before or after they eat. You can choose either one. You just want that consistency, because if you're weighing them sometimes at 8 in the morning and then sometimes at 6 at night, sometimes before eating, sometimes after, it's really hard to see a whole lot of consistent moving. You want to just choose a general time of day, and whether it's before or after they're eating, so you can just kind of see that progress in a way that's more clear. So we always weigh in grams when kittens are under a pound, and then once they're over a pound, we switch to pounds and ounces, as long as they're nice and stable. The other thing you have to do is help kittens use the bathroom. When they're with their mom, she actually licks them to help them poop and pee, and she actually ingests their poop and pee. You don't have to do that, but you do have to help them potty. And the reason that moms do that is because it's an instinctual thing, because if they're outside and the kittens are peeing and pooping all over the nest, that's going to draw predators to the nest. But it also helps keep the kittens more sanitary and clean. It's a misconception that kittens can't potty on their own. And so a misconception amongst some bottle feeders is that you have to help stimulate them because they physically cannot go on their own. That's not true. They absolutely can, but we want to stimulate them at every meal because we want to get ahead of the mess, because of course these kittens sitting, if they pee on themselves, if they poop and they're laying in it, that breeds bacteria. It can, bring pests in. Like, we want to get ahead of keeping the kittens clean, because that will cut down on problems that they have in the future, especially when we're thinking about urine, which is very acidic, and it can actually cause what's called urine scalding on the kitten's legs and belly. So we want to be really careful about that. So what you'll do is at every meal, and you can choose to do this before or after the meal, you'll want to take a tissue or a wet wipe, a clean cloth, and just gently stimulate their genitals and their butt. Pretty much at every time you do this, the kitten generally is going to pee, and that pee should be clear or very light yellow. If you're seeing pee that's very dark, if it smells very strongly, those can be signs that the kitten might be dehydrated or have an infection. And then kittens on average, when they're this age, are going to poop about once a day. And that poop, if it's healthy, is going to be about the consistency of toothpaste. and it's going to be brown. Sometimes the formula causes it to be a brownish yellow, maybe like a slight orangish tint to it. But if you're seeing poop that's rock hard, if it's liquid or, really squirty and soft, if it's, bright mustard yellow or kind of chunky, if there's a lot of blood in it, if it's gray, green, stuff like that, those can all be signs that, either your kitten is dehydrated, might be some sort of bacterial infection going on, might be parasites, something like that. Poop is a pretty good indicator of a kitten's overall health. And it's also notable that kittens who are transitioning from mama's milk to formula may not poop for a few days. And that is fine, as long as the kitten's belly stays nice and squishy soft. And as long as the kitten's not straining and trying to poop and just not producing anything. As far as the basic medical care a kitten is going to get if they are under the care of a rescue, prior to adoption, most organizations are going to provide deworming. Organizations are generally going to do that proactively. So these kittens are going to be dewormed for a series of weeks, just because most kittens are born with some parasites. So we'll do that proactively, even if no worms are cited. They'll be treated for fleas. They'll be given age-appropriate vaccines, disease tested. We're talking, FIV and FELV, spayed and neutered, and microchipped. And we do always suggest that kittens are quarantined for about 2 weeks when they're new, and that's because a lot of illnesses, diseases, parasites can incubate in a kitten for 2 weeks before they show any symptoms. The disease that we're always most worried about is called panleukopenia or panleuch. It's a really highly contagious and highly deadly disease. The symptoms of that would be vomiting, diarrhea, they get lethargic, they, don't want to eat, they start losing weight really quickly. It's a really, really horrible, painful disease for kittens. That disease, they are protected by that disease from the core vaccine that kittens get. However, the earliest it's safe to vaccinate a kitten is once they hit a pound, which is usually around 4 weeks old. And they need to wait 2 weeks to get a booster vaccine. And generally, kittens are not considered to be protected from panleuch until they've had a series of 3 vaccines. So assuming your kitten is in the care of the rescue when they're 4 weeks old, it's still 8 weeks before they're 8 weeks old before you can consider them pretty well protected from panleuch. So you just want to be really careful about that. So for 14 days, we do suggest keeping them in some sort of dedicated housing away from resident animals, particularly if your animals are not vaccinated, away from other foster animals. And just be really mindful when you're handling the kittens, holding them. You don't want to hold the kittens against your clothes and then take other foster kittens and hold them against your clothes and, mix litters that way, because you don't want to accidentally expose kittens to something that now potentially is on your clothes. Some of the common challenges that we see with these neonatal kittens, we see a lot of eye infections, a lot of respiratory infections. So, kittens with snotty noses, coughing, sneezing. See a lot of kittens who are underweight, have diarrhea, or are constipated. We see a lot of dehydration, and we see a lot of fleas. Some of these can be linked together. So a kitten who's constipated, or a kitten who's dehydrated may also be constipated. A kitten who's having diarrhea might also be underweight. A kitten who has a respiratory infection might also have an eye infection, stuff like that. So some of these things can be linked, but they don't have to be. And these are what we consider at the Kitten Alliance to be emergencies. This is the information we give to our fosters. Generally, an emergency would be if the kitten's severely lethargic, if they have labored breathing, they're cold, they're pooping and it's very, very bloody, or they have really severe diarrhea, consistent, regular vomiting, seizures, anything like that. These are the emergencies that our fosters call us for if they're having like overnight emergencies. And then I do want to take a minute to talk about fading kitten syndrome. Fading kitten syndrome is not its own illness. What it is it's an umbrella term to cover a set of symptoms. So generally, if your kitten is fading or crashing, I know we've talked about that several times tonight, the symptoms you're going to notice are lethargy, lack of appetite, rapid weight loss. They might be cold to the touch, pale gums, their eyes are kind of unfocused and glassy, and they may be labored breathing or even gasping. So fading kitten syndrome generally happens for one of four reasons. Either the kitten is hypothermic, so they've gotten too cold. That is why we want to keep that consistent outside heat source with them for the first 4 weeks. They might be hypoglycemic, so their blood sugar has dropped. And that is why we're feeding them on a very consistent schedule, try to keep that blood sugar up. They might have some sort of internal infection. Oftentimes, if that's the reason a kitten's fading, you're probably already seeing other signs that the kitten has an infection, but maybe not if the kitten's new to you. And then the other thing, the one that I personally believe is most common is a birth defect. So these kittens have some sort of congenital condition where something in their body is just not wired right. And, they just hit some sort of milestone that triggered something in their bodies, and their bodies just can't handle it and can't grow anymore. Because it's really hard in the moment to fully understand why a kitten is crashing, basically the action plan is to try to tackle the two potential causes that are something that you can treat. So that would be hypothermia and hypoglycemia. So what we do is wrap the kitten up in a soft blanket into a burrito. So you want to wrap their whole bodies up, even wrap up their head. You just want to leave their face exposed so they can breathe. You can even take a heating pad set on low and wrap it around the blanket. So you want to just get them nice and warm. The next thing you're going to do is take some sugar water or Karo syrup, some sort of sugar, and you're either going to drip a drop of it on their tongue, which you can do as long as they're alert enough to be lapping it up and actually swallowing it. If they're not, what you can do is dip a Q-tip in the sugar or corn syrup, whatever you're using, and just either touch it onto the kitten's tongue or rub it onto their gums. And you're going to do that with the sugar every 3 minutes. And that you want to go ahead and set an alarm for that and just keep doing it every 3 minutes, because that's a really important part of getting the kitten's metabolism jump started. And then the other thing is just to be patient. Sometimes it can take, sometimes the kittens can bump out of this in 10 minutes, and sometimes it's an hour. So you just want to be patient for as long as the kitten hangs in there. And I always want to talk about the mortality rate of neonates. It's a little bit dark, but I think it's really important when you're going into caring for these kittens to understand that on average, about 40% of kittens who enter shelters or are in foster homes pass away within the first few weeks of their life. And that's despite very skilled care. And if you are fostering on a regular basis, it's pretty much inevitable that you're going to have a loss at some point. So I always like to talk about this because I want you to understand that if or when that does happen to you, that it's not your fault or as a result of anything that you've done, likely. Neonates are just very, very fragile. We never know, or we rarely know, what they could have been exposed to before they come to us. Remember, a lot of these kittens are being found outside. We don't know often a whole lot about their mom. We don't know whether there's inbreeding happening. We really don't know a whole lot about them. We usually don't know the medical history of mom. because a lot of these kittens are being born outdoors, mom often doesn't have any medical history at all. And if the kittens have truly been abandoned, we don't really know why. So sometimes moms leave kittens behind just because she intuits that something's wrong with them. So maybe she intuits that they have some sort of congenital strange thing happening, and mom has decided that that kitten is not viable. And sometimes that is the reason that mom, takes the other kittens away and leaves one behind. But it's important to know that 100% of these kittens would die without a foster parent taking care of them. So even if we can save 60, 70% of them, that is huge. And then I also want to talk about compassion fatigue, which is a very real thing for people who are doing the hard work of caring for kittens. So this cat here is my cat Toby. If you remember from the first slide, the kitten who had the umbilical cord wrapped around his leg, this is him now. And compassion fatigue is basically anybody who's investing a lot of time caring for any creature who's the impact of trauma, which most of these newborn kittens are. It can be really, really emotionally and physically taxing. So if you're experiencing compassion fatigue, some of the signs you might notice are mood swings, insomnia. You might be more irritable than normal. You might have a change in appetite. You may feel depressed, anxious, have digestion issues, have headaches. If this is happening, definitely try to be in touch with your body and feelings and really respect what your body's telling you. It's okay to take breaks. It's okay to say no if your shelter is reaching out to you and begging you to take kittens and you're feeling very anxious and depressed and not sleeping well, and you're experiencing, one or more of these problems. It's okay to say no. It is not your responsibility to save every kitten who needs help. And I know from experience that it's really hard to really take that in, but it's really crucial that you're taking care of yourself, because we can't continue to save more kittens unless we're paying attention to what we need as well. We need to keep ourselves healthy. So what I like to do is make a list of the things that I enjoy that are simple, that help me recharge. And what helps you recharge is probably going to depend a lot around whether you're an introvert or extrovert. But, having a list handy where in the moment you don't really have to think about it, you can just pull out a list and choose something to do, I find is very healthy for me. I do tend to lean on the introvert side. So for me, my list is generally watching movies in bed, reading a book, going for a walk, taking a shower, kind of just stuff like that. If you're more extroverted, maybe it's going out with your friends, going to a concert, something like that. But again, there are way, way, way more kittens who need help than we can possibly ever actually help. And we need to make sure that we are being reasonable about what we are capable of. If newborn kittens are not something that you feel are the right kind of animals for you to be taken care of, that's totally fine. There are many other animals in shelters who need help. So some of the other animals you could consider would be pregnant and nursing moms. Those are really fun because you get to hang out with the newborn kittens, but mom basically does all the hard work. You still do need to weigh them and make sure that they're gaining, and you might need to supplement them with formula a little bit, depending on if she's not making enough milk. But generally, she does most of the hard work. Animals who are sick or injured need fosters while they're recovering from illnesses and injuries. They recover a lot more effectively if they're in foster homes where they're receiving the extra care they need. And then there's also older healthy kittens who, just need to gain half a pound before they're able to get spayed neutered, before there's, before they're ready for adoption. So those kittens are really fun and easy too. That is it. Before we go though, I want to tell you a little bit more about this program that the Kitten Alliance started. Basically, I started it because it took me, it's taken me 13 years of my career to learn all the stuff that I know about kittens. And I know how overwhelming that is to be really wanting to help and not really knowing whether the information you're getting, if you're just Googling for information, whether it's reputable, whether, stuff like that. So we put together a program called Kittenology that involves courses. There's going to be this whole year a new course released every month. There's a ever-growing library of downloadable resources. So all of our protocols and charts and stuff are in there, and you can just download them and pop them right into your own kitten program. There's a private online community in Facebook, and then once a month there's a group call where you can jump on, in the first 10 or 15 20 minutes is going to be us teaching you about something specific, some topic, and then the rest of the call you're going to have a chance to ask any questions you have about any sort of kitten problems you're facing. This will outline the courses you're going to see this month. So Bottle Baby Kitten Care 101, which is essentially the course you're taking right now, was released in May. Excuse me. Next month, a course is going to come out of Bottle Baby 102, where we're going to talk about the more difficult cases. We'll talk about when to syringe feed versus when to tube feed, different challenges you might face if you're taking the younger or sicker kittens. In July, we're going to talk about the best practices with weaning and litter training. In August, we're going to talk about caring for nursing moms and their kittens. In September, finding and keeping foster parents. That one is for people who work with rescues. In October, we'll talk more about compassion fatigue. In November, we'll talk about fundraising for kittens, because it obviously costs a lot of money to raise these guys. And then in December, we're going to talk about best practices for marketing kittens for adoption. So we'll talk about how to write good profiles, how to take good pictures, kind of all that stuff. The resource library is growing all the time. I'm always adding new resources in there, but you can just download all of our protocols and just action them right away. You don't really have to think about it. The first monthly group call is happening on May 31st. So if you sign up for Kittenology before then, you'll be invited to that call. And as soon as you sign up, you can join the Facebook community. And then you also have access to one-on-one coaching calls with me. So if you work with a foster program and want to spend 30 minutes or an hour talking through your problems and getting some support with building your kitten program, I'd be more than happy to help you with that. From now until May 31st, if you sign up using the promo code EARLYCAT20, you do get 20% off your first 3 months of the program. So if you're potentially interested in that, I would go ahead and write that down. It's a pretty good deal. That is that. And we basically made that so that I can have a platform to just teach you everything that I know about kittens. I really want everybody to feel very confident when they're taking care of these kittens, and making sure that everybody is getting all the information that they need. So that is it. And thank you so much for attending Bottle Baby Kitten Care 101. And you can always email me at andy@kittenalliance.org if you have any questions. And thank you so much.